Chronic kidney disease, symptoms and treatments. The kidneys are one of the most important organs in the body. They are located at your lower back on both sides of your spine. The kidneys serve as the body's waste filtration system. They filter waste from food, alcohol, medications and toxins, such as tobacco. Furthermore, they keep the body's fluids balanced, thereby regulating blood pressure, and are in charge of producing red blood cells. The kidneys also steady electrolytes, make hormones and promote the health of the bones. However, the kidneys could begin to malfunction, which means that they no longer filter the blood effectively. This condition is known as chronic kidney disease, or CKD. Chronic kidney disease is an abnormality in the structure and function of the kidney for more than 3 months. According to the US National Kidney Foundation, about 90% of people with kidney disease are not aware they have it. When the kidney disease is in its early stages, you may not be able to detect it yourself because there are little or no symptoms. The symptoms are more pronounced as the condition worsens. This is why you were advised to go for regular medical checkups, so that the kidney disease can be detected on time and treatment done. If the condition is not detected on time, it can lead to kidney failure, which can be fatal. Stages and symptoms of chronic kidney disease. The kidneys normally secrete waste in the form of urea through the urine. But when the rate of filtration of the kidney is reduced, there is less urea in the urine. Since the urea has nowhere else to go, it begins to be absorbed into the blood. This condition is known as azoturia. Chronic kidney disease is divided into 5 stages of severity. Tests like eGFR and urine tests are taken to determine the level of kidney failure. The eGFR test is done to measure the rate of glomerular filtration in the body, and the urine tests are done to check the presence of protein in the body. These are the 5 stages of chronic kidney disease. Stage 1. Stage 1 of chronic disease has an estimated glomerular filtration rate, eGFR, of 90 or greater. At this point, your kidneys are working well, but have begun to show some signs of kidney damage. There are no symptoms at this stage since your kidneys can filter waste and toxins. So, if it is discovered at this point, there is a greater chance of successful treatment. You should do the following. Exercise regularly. Eat healthy foods. Try to reduce stress through having enough sleep, rest and meditation. Reduce or completely eliminate smoking. If you have diabetes or high blood pressure, take medications to control them. See a nephrologist, kidney doctor. Stage 2. At stage 2, the CKG has an estimated glomerular filtration rate of between 60 and 89. At this point, your kidney functions have reduced a bit and show more signs of kidney damage than in stage 1. However, since the damage is still mild, you may not yet show symptoms. You should exercise regularly, eat healthy foods, try to reduce stress through having enough sleep, rest and meditation, reduce or completely eliminate smoking, take medications to control high blood pressure or diabetes if you have them. See a nephrologist. Stage 3. Stage 3 CKG has an estimated glomerular filtration rate of between 30 and 59. It is subdivided into Stage 3A with an eGFR of 45 to 59 and Stage 3B with eGFR of 30 to 44. Here, the kidney functions have reduced even more, so the waste buildup in your blood has begun to increase. This buildup may then begin to affect the bones, causing anemia and high blood pressure. You may start experiencing symptoms such as back pain and peeing too much or too little. Alternatively, you may not experience any symptoms at all. Stage 3 CKG can still be managed with proper care, and it involves proper diet. You need to give your kidneys less work to do. And one way you can do this is by eliminating processed foods from your diet and eating natural foods. You should also reduce foods high in potassium, such as potatoes, beans and bananas, and reduce your salt intake. To avoid being malnourished, eat frequent meals. See a nephrologist. You will be asked to take medication for diabetes and high blood pressure. You will also be given other medicines to help with iron, cholesterol, calcium and vitamin D. Regular exercise. Relieve stress through proper rest, sleep and meditation. Stage 4. In stage 4, the rate of damage to the kidney has become severe. The glomerular filtration rate is between 15 to 29. At this point, your kidneys are no longer filtering your blood well, causing a buildup of waste in your body and causing high blood pressure, anemia and bone disease as a result. You will begin to experience symptoms such as fatigue, pain in your lower back, urine that looks red or dark in color, among others. This is the last stage before your kidneys fail, so you should do the following. You will see your nephrologist regularly for closer monitoring. You will be tested for levels of creatinine, calcium, potassium, hemoglobin, bicarbonate, protein and fluids in your blood and urine. You will also begin to prepare for dialysis or a kidney transplant. Meet with a dietitian who will show you what kinds of food to eat. Stage 5. This stage is also called end-stage renal disease. Your estimated glomerular filtration rate has dropped to 15 and below. At this point, your kidneys are failing or have failed. The buildup or waste in your blood then begins to cause symptoms such as nausea and loss of appetite, pericarditis, inflammation of the lining of the heart, causing high blood pressure, insomnia, low calcium levels, hypocalcemia due to less vitamin D in the blood, bubbling or foaming in urine due to presence of protein in urine, peeing too much or too little, unintentional loss of weight, lower back pain, swelling of the legs and arms. The following are what you should do at this point. Continue to see your nephrologist regularly. Meet your dietitian to show you a diet suitable for your condition. Begin to prepare for dialysis or kidney transplant. Have friends or family that can support you during your period of dialysis or kidney transplant. Treatment for kidney disease. 1. Early detection. The best treatment for kidney disease remains early detection. Early detection can help you identify and properly manage the underlying causes of the kidney disease. You will also be given medication to slow down the rate of damage to your kidney and help you live a healthier life. 2. Dialysis. Dialysis is a procedure where a machine called a hemodialysizer or artificial kidney removes excess water and toxins from the blood in place of the kidneys. This procedure is done when the kidneys can no longer do these things on their own. There are 2 kinds of dialysis: hemodialysis, HD, or peritoneal dialysis, PD. In hemodialysis, a tube is attached to your arm, and your blood passes from the tube to a hemodialysizer that filters the impurities in it before passing the blood back to you through another tube. You can do this either at a clinic or at home about 3 times a week. In peritoneal dialysis, the inner lining of your abdomen, known as the peritoneum, is used to filter your blood instead of a machine. The peritoneum is made up of thousands of tiny blood vessels, which means that it is capable of filtration. The procedure is done by making a cut near your abdomen and inserting a catheter into the peritoneal cavity. A special fluid called a dialysis fluid is then pumped into the peritoneal cavity through the catheter, which will draw out the waste products and excess fluid that passes through the blood vessels in the peritoneal cavity. The dialysis fluid is then drained into a bag periodically and a new fluid is replaced. The procedure can be easily done at home and allows you to go about your life normally, since changing the dialysis takes about 30 minutes and needs to be changed about 4 times daily. 3. Kidney transplant. A kidney transplant involves someone who has kidney failure receiving a healthy kidney from a donor. The donor could either be alive or deceased. Donors who are a good match can decide to donate one of their kidneys to you. People who donate a kidney can still live healthy lives with one kidney. Donors could be a family member, friend, or a kind stranger. To reach a kidney transplant from a deceased organ donor, you will have to be on a waiting list of the United Network for Organ Sharing, UNOS. When a matching donor kidney is available, you will be notified by your hospital. After the transplant procedure, you will be given anti-rejection medicines, also called immunosuppressants, and other kinds of medicines. The purpose of this medicine is to help your immune system to not reject the new kidney, so that it can continue to work for you. You will need to take this medicine regularly for the rest of your life. However, the medicine suppresses your immune system, so you have a higher risk of getting an infection. As a result, you should take care to avoid anyone who is sick or has an infection for some months after your surgery. You might also experience some stomach upset as other side effects of the immunosuppressants. In any case, see your doctor immediately. Conclusion: kidney failure is one of the highest causes of death in recent times. This is because it has little or no symptoms in its early stages. When symptoms begin, then the condition has already advanced to later stages. Due to great advances in the fields of medicine, chronic kidney disease is no longer a death sentence. It can be properly managed through early detection, dialysis, and kidney transplant.